This is Dr. James with Helpmommy.com, and this is video 1 of 5 talking about 2-month-olds. In this first video, we're going to talk about what they should be eating. So a 2-month-old should just be drinking that milk, whether that be breast milk or formula. That is the only thing they should be eating or drinking. Resist the temptation of all the advice of you should be giving them cereal. You should start feeding them early. They'll sleep through the night. 1, that's not necessarily what causes them to sleep through the night at all. 2, their gut's not ready for it. They have found that early introduction of solid foods can increase allergies, eczema, asthma. So it's just not worth it. As far as drinking something besides milk, babies' kidneys are very, very sensitive, and every year, there are multiple babies that end up in the intensive care unit having seizures because people gave them water or juice and it drove their serum and sodium down to a level that they started to have seizures. Milk, be it breast milk or formula, is perfectly formulated to make sure that your baby's not only getting the right fats and calories, but also the right electrolytes. So don't mess that up. As far as amount and frequency, these babies are going to be drinking quite a bit. In fact, most babies are going to get to the maximum amount of milk that they're going to drink somewhere around the time they're 2 to 4 months old. And so most babies, if they're drinking from a bottle, are going to be somewhere in the 4 to 8 ounces every time they eat. Of course, with breastfeeding, you don't really have a gauge, but they're going to be usually eating about that same frequency every 3 to 4 hours. It's at this point that they get where some of them will start to store glycogen and can actually make it longer in between feeds. This is where you'll start to hear moms bragging about the fact that their baby's sleeping through the night. Other moms want to burn those moms with a pitchfork and fire and just torture them because they're still not sleeping through the night. It happens, but some of them will. At this point, we do not need to wake up a baby to eat. If they sleep through the night, that's fine. I have babies that sleep 8 to 12 hours a night without eating. In fact, sometimes the breastfed babies are being woke up by their mom, not because it's time to eat or because the baby needs to eat, but because the mom needs some relief because she's feeling pain because the baby hasn't had any food and she's feeling engorged. That, of course, is okay. But that's it. They need to drink milk, be it formula or breast milk. If they're breastfed, moms, you need to make sure you're still taking your prenatal vitamins. This is how we want to protect your bones and just give you a little bit more energy. Breastfeeding is very hard on your body. Great for the baby, not so great for you. So try and take those prenatal vitamins to give you a little extra as you're breastfeeding. The other thing with our breastfed babies is they're not getting enough vitamin D through their breast milk. So we want to give vitamin D infant drops on a daily basis. Depending on the brand you buy, you may get 1 drop or 1 dropper per day. Make sure you read those instructions. The formula-fed babies, they don't need anything extra. So just formula or breast milk at 2 months old. Nothing else. If there's going to be anything like thickening feeds or anything like that for reflux, make sure it was your doctor that recommended it.